Alrighty. It looks like we're recording right now, right?
Yeah, I believe so.
Okay. Thank you, everybody, for joining. I'll just get us started. I appreciate everybody's patience with these technical things. Welcome to our webinar today. We are from the Committee of Interns and Residents, CIR. CIR is the largest house staff union in the nation. In addition to protecting our members by winning strong contracts on the traditional things that come to mind when you think of unions, like salaries, workplace safety, and healthcare benefits. We support over 17,000 resident physicians and interns to improve residency training and education, to improve patient care, and to expand healthcare access for the communities that they serve. I work at CIR as a quality improvement director, and in addition to overseeing the patient safety and quality improvement work of the union, it's my unique privilege to also oversee the well-being work. Portions of our membership have come through an unprecedented, in many ways, traumatic experience serving during the global pandemic, and I was so happy to support the creation of this space where we're going to break down the experience that's unique to residents and share some ideas that participants will be able to bring back to their own institutions. So with that, I'm going to hand it over to Dr. Ala Alanajar.
Thank you so much, Vivian. I'm trying to see if I can see your screen. Oh, yeah, here it is. Welcome everyone, and thank you for the introduction, Vivian. And thank you for joining us today to be part of this webinar. It's an important subject to discuss, and it's close to my heart. We are talking today about the impact of COVID-19 on the mental well-being of physicians. Next slide, please. And here is our panel. Thank you so much for joining us today. And Dr. Foreman gonna introduce all of them later and before the panel discussion. Next, please. And this is our agenda for today. So Vivian did the introduction. I will speak about the scope of the problem. Rachel will speak about CIR responses and our wins. And then we will have a long panel discussion here from all your questions and comments about mental health during residency. And then we will have it with closing remark with Brandon. Next, please. Yeah. So I want to start by asking all of you to join me for a minute of silence in honor of all the physicians who we lost to suicide. April 2020 at New York City, we lost one of our colleagues. One of our colleagues at emergency medicine. This was Dr. Lorna Breen. So let's take a minute to honor that. Okay. Thank you everyone for joining us in that. As a psychiatrist, one of my deepest pain is when I lose one of my patients to suicide. While I didn't know Dr. Breen personally, her loss during our fight of this pandemic filled me with guilt. I felt the guilt of failing my own colleagues in medicine. How come I couldn't help more? As a CIR leader, as a mental health advocate, how couldn't I do more? I soon realized that I was able to process these emotions with my therapist. I was able to switch that guilt into hope. My hope from today's webinar is that we will be able to have a first step, a moment of change, to have a better access to mental health care among physicians and support them with everything we can. And I hope you will be able to help us with that. Next slide, please. I want to start by checking on every one of you and see how are you doing today, and see how can you share one thing that you do to take care of your well-being during residency. And if you don't mind, start typing that into the chat, and we will start taking them while I'm telling you how I do so myself. So I'm very grateful to all the support that I have in my life, my family, my colleagues, my friends. As an immigrant and a parent, those social supports were crucial to me and my mental well-being during the COVID-19 apex in New York. I have to say, after COVID-19, the thing I did and helped me a lot was to be connected with people in my life in a deeper level. And remembering as a caregiver that I have to take care of myself as well. I remembered that although I'm a caregiver and a physician and a parent, I'm also a partner, and I'm also a daughter and a friend. And while pursuing my dreams to be a healthcare advocate, I took a pledge to take care of myself as well. I want you all to do the same. Please Zoom with my friends I see in the comment. Talk to small group of friends. Okay. Seems like connection is a big thing for residents and physicians. And I do believe the hardest hit that all of us took with the COVID-19 is the isolation and not able to see each other in person. And I hope while we're trying to connect today through the Zoom that we will be able to restore that as well, even if it's virtually. Next slide, please. So when it's come to burnout and physician well-being, there's a lot of factors. It is a complicated problem. It can be systemic or personal. Those are some of the problems out there. But we will want to hear from you more about what is it that burn you out in your hospital and what would you like to do differently during our panel discussion. Next slide, please. So we know before COVID that suicide among physicians is the second most common cause of death. And without adding all the other reasons here in that slide, like accidents and accidental poisoning, this number could be the first cause of death among physicians. And this is a very big number that break anyone's heart. And it's a problem that everyone should be part of solving. Next, please. So those are the three facts that I wanted to share today before our panel discussion. While we have a lot to understand about this problem and a lot of research to be done, we lose about 300 physicians every year in the United States. Physicians are less likely to be receiving mental health treatments who took their life compared to the non-physicians who took their life even though depression was found to be a significant risk factor as approximately the same rate in both groups. 28% of residents experienced major depression during the training versus 7 to 8% of similarly aged individuals in the US general population. And that shed the light on a problem that has been there before the COVID-19, and COVID-19 just made it even apparent. And with that being said, I want us to be all united front. And I would like to switch the mic into Rachel, my colleague, to tell us about how CIR try to work and advocate for residents' mental well-being during and after COVID-19. Rachel, next slide. That's for you. Thank you,
Thank you,
everyone.
Allah. I'm very excited to tell you guys about CIR's well-being win during COVID-19. So next slide, please. So the first thing I want to tell you about is the Resident Bill of Rights. Even before COVID-19, too many interns, residents, and fellows were forced to work in conditions that impaired their ability to provide quality patient care. Facing sleep deprivation, overwork, and inadequate access to medical and mental health treatment, residents caring for their communities were not being properly cared for themselves. The challenges residents have faced for generations are only exacerbated by COVID-19. That's why on behalf of residents, and patients, we're calling on the healthcare industry, especially hospitals, ACGME, specialty boards, and elected officials to recognize the following core rights. That includes a living wage, access to mental health services, no more than 80-hour work week, not as an average, and including non-clinical tasks, time off for sick leave, access to parental leave, and access to healthcare, recognition of a full-time worker's rights to organize, transparency, standardization, and due process at member institutions. The Bill of Rights also include equal access to learning and career development, adequate staffing and support. And I'm proud to say the Resident Bill of Rights have been endorsed by several politicians, including Vice President Joe Biden. It is a tool to raise the standards for both unionized and non-unionized groups. And this can be found on our website at newrealitynow.com. And then I invite all of you to go to newrealitynow.com and sign to support our Bill of Rights. Through our union, and regarding COVID-19 specifically, there was a multi-regional task force that was created to create national COVID demands. And we sent an open letter that you can find on our website that we sent to ACGME and ABIM, for which we received a reply. And we also sent out newsletters at the height of the pandemic to keep our members informed. Next slide, please. So these are some of our specific wins. So through our collective action, through our union, CIR residents have secured impressive resources and protections to help protect their well-being during the pandemic. These include one-time bonuses of $1,000 to $2,500, base salary increases from 2.5% to 10%, and weekly salary increases up to $400 per week. The work has not been limited to our hospitals and communities. CIR residents across the country have met with state legislators to push for residents to be included in new laws governing workers' compensation in the public and private sector. The worldwide shortage of PPE has put all of our nation's healthcare providers at risk. And in too many hospitals, staff members report turf wars over who receives masks and who doesn't. Unfortunately, because of our place in the hospital hierarchy, residents are often unable to access PPE or even speak about the shortages without fear of retribution. So now residents and fellows have banded together to fight for an expedited process to obtain PPE outside of going to the nurse's station on each unit. We also have won more equitable and streamlined processes to access appropriate PPE, as well as process to escalate situations where we are denied PPE. CIR residents also coordinated the donation of millions of items of PPE. We forced hospitals to accept donations from the community, made sure residents were represented on PPE committees, and helped launch national coordination efforts to secure more PPE. In order for residents to remain on the front lines, keeping their own families safe, residents in COVID hotspots ensured house staff were among the frontline providers who were able to get temporary hotel accommodations from the city in which they lived with someone who is high risk. And I've helped coordinate these efforts in Miami myself at Jackson Memorial Hospital, where I used to work. We banded together with other unions, including nurses union, to advocate for and receive help from the state to pay for childcare for frontline providers. And in many hospitals, residents work within their departments to keep their colleagues safe and their training on track. Psychiatry residents like Allah organized and won faster transitions to telemedicine. And dental residents organized and were able to change COVID redeployment to a specialty that was more in line with their training. So that's just the surface of what we have done so far with CIR. Now I want to turn it over to our moderator, Dr. Porman, and the panel to hear firsthand perspectives on what happened during COVID and propose next steps for greater and more sustainable resident and fellow well-being. Dr. Porman is a general internist and addiction medicine fellow at University of Washington. She completed medical school at Emory University in Atlanta and residency at Cambridge Health Alliance, where she practiced as a primary care physician before coming to Seattle. In addition to her duties as an internist, she is an accomplished writer and speaker. She has written about her experiences with mental health, treatment and medical training, and has published numerous academic and lay press articles on depression and suicide risk as an occupational hazard of medical practice. She has also published dozens of widely read articles on how to provide ethical care in a deeply dysfunctional healthcare system. She has spoken at residencies, medical schools, and hospital systems across the country on the importance of mental health access for physicians. It's my honor to introduce Dr. Porman.
Thank you. Thank you so much for that introduction. I am just thrilled to be here with you guys today. And I'm honored to be able to introduce our panel. I just want to thank the people at CIR, especially Vivian Fernandez, Dr. Manolo, Ala, and Brandon for putting this together so thoughtfully. I think the panelists on who are going to be speaking today represent a great diversity of experiences, of specialty training, of regions. And I think there's just been so much thought and care put into this. So I'm very excited to be here with you. So we're going to get right to the panel, but I just want to do a little bit of housekeeping. I'm going to ask some initial questions, but if you have questions, please feel free to type them into the chat box. I'll do my best to incorporate them, and other panelists, if you see chat questions, or Vivian, if you see chat questions that you'd like me to address, feel free to break in. So I'll go ahead and introduce our panel. So we have Dr. Ala Al-Najjar. Ala is a New York Regional Vice President for CIR, as well as a Child and Adolescent Psychiatry Fellow at Montefiore Medical Center. She's the founder of Connect Space and very passionate about teaching, well-being, and technology. Ala is also an international medical graduate from Egypt, where she did her first combined neuropsychiatry training. Dr. Kelechi Weze is a PGY3 internal medicine resident at Howard University Hospital. He's passionate about resident-led advocacy and is one of 2 regional vice presidents for the DC, New Jersey area. Dr. Brandon Newsom. Dr. Newsom is a psychiatrist and physician leader out of Massachusetts. He has a wealth of experiences on diversity, inclusion, and wellness, and how to advocate for those in training programs and academic institutions. He's now pursuing a fellowship in child psychiatry at Children's National Medical Center in DC. Dr. Rachel Manolo is a pediatric cardiologist at Valley Children's Hospital in Bakersfield, California. She recently graduated from her fellowship at Jackson Memorial Hospital in Miami in June of 2020, a place that I had the honor of visiting. And there she served as the regional vice president for the Florida for the Committee of Interns and Residents. And finally, Dr. Anna Yap is a 3rd-year emergency medicine resident who's active in multiple resident leadership organizations on the state and national level, including serving as the member at large of the American Medical Association and Fellows Governing Council, and also the Southern California UC Vice President at CIR. So I wanted to start by asking each of the panelists if you could just describe the nature of the work that you did during the COVID pandemic, either a wave that may be receding as for those of us who were in the Northeast, or a wave that is just beginning to peak as it is unfortunately in too much of the country. So I'd like to start with Dr. Kelechi-Weze. Can you describe to us what your experiences have been like so far in the pandemic, and perhaps what you've noticed about how that affected your well-being?
Great, thank you for the great introduction. I think with the pandemic, I've experienced a broad range of emotions. I think probably started with denial when all of this was some international news, to more of trepidation, and then panic, and then exhaustion, and now to just accepting things for what they are. I think when we first started having first cases here in the DC area, I was on vacation at the time, and I think that for me, that was like a very important period. As we all know, in residency, you don't get that much time off, and as someone who has most of his family internationally, it was really important time for me to be able to spend time with them, and had those plans. And I think for me at the time, my concerns were more selfish about how it was impossible for me to go spend time with loved ones, and I had to be home the entire time. I think at the end of that was unfortunately or fortunately coincided with the peak of the pandemic here, was when I went back to work and I was in the ICU. And I think, that was when I started to experience emotions of panic, because we just saw an onslaught of patients and kept expanding. And I think that at that time, it was mostly just not having time to process what was happening. But I think one of the things that I really remember was just thinking about my patients, of course, whose families couldn't come in at the time. And so we had to do daily updates to tell people, here's what's going on with your family member, and here's how they're doing, and to hear people express frustration at not being able to do more for their family members. And, have that, reflect on that, and how that, related to my family as someone who had an aunt who was also diabetic and who was working in a high-risk environment here in the States, and constantly thinking about her. And I think we went through all of that, and I just remember that one of the things that struck out was that we never really had time to debrief about what was going on. It was mostly just going through the day, making it through, trying to get adequate rest, and then coming back. But eventually finishing the ICU, and I think the cases have now died down. But I would share this personal experience that the aunt that I was really afraid of eventually did pass of COVID. And it was sort of a moment for me to then just reflect on this entire experience, and how I didn't really have time to process what was going on, and how probably my coping mechanism in dealing with the families I was talking to on the phone was to block out the emotional component, what was happening to them at the time. But I think just, having time to mourn with my family at this period has just given me time to reflect on what's happened, and, the magnitude of, what I'd been through, and possibly what my other colleagues over the country, I think our experiences were very similar. I think most hospitals didn't allow visitors to come in. And I think residents had to take on the burden of not just caring for patients, but also communicating with families and telling them what's going on, and also dealing with personal life. And then so this is sort of a broad range of emotions that I felt, and I think is something that we've all felt in this pandemic as well. So in short, that's kind of my experience.
Thank you so much for sharing, Dr. Weze. And I just want to say I'm so sorry for your loss, and I'm so sorry for the interrupted grieving process that you've experienced and so many of our patients have experienced. And I saw a lot of head nods from the other panelists, and I wondered if anybody wanted to touch on some of the things that Dr. Weze had brought up, and also describe some of what you had experienced during the pandemic so far. Dr. Al-Najjar?
Hi, thank you, Dr. Foreman. You can call me Ella. Thank you,
I
Kalisha, for
was raised
sharing
in
that.
the South, you can't help it.
Yeah, no problem. I think hearing your story reminded me with something that one of my friends is currently going through. So she's an international medical graduate as well, and her parents in India, and one of them just got admitted to the ICU for COVID. She can't travel to go see them so far, and I just um, that fear of mine because I share the same thing. Um, I realize it's not just IMGs, even people who are living in the States can even go to other states to see their loved one. And even people in the same state can even see their loved one across the street, which is some of my co-fellows here, who their parents lives across the street from them. And you just have to wait from far away. So as much as it's different from with the distance, but it just touched a lot for me about how COVID took away some of our social connection with our family and friends and loved one. Thank you for sharing.
Yeah, I think that's a great point, Ala, and I guess I would want to ask your advice, because I think you know, for many residents, having that touch point of family and friends during the residency process, which can be sometimes very dehumanizing, and we certainly know that, you know, the majority of us are going to experience some kind of diagnosable mental illness during residency training, whether or not we get diagnosed. But having those people to check in with us is so important. And so I wonder if you, as an international medical graduate who had already been dealing with that kind of separation and isolation, if you had any insight or thoughts to share with us who are experiencing that for the first time.
Yeah, I think that's an important question. I think it did affect me as an international medical graduate. I guess not having my family around will make rely on the people who are living on the United States as to be my friends. I made another home here and a second home that I love with everyone connected with. But after COVID, even the people who lives with me in New York, I had some difficulty of seeing them. So one of our holidays just passed, which called Eid, and it was difficult to get to see other people and do prayer the same way that we used to do it before. So I think that impacted me in a way that I felt like for after 7 years being in the United States, I used to be less alone. And then COVID kind of brought me back to day one, JFK, being in the subway with my 1.5-year-old daughter. It just brings some of those flashbacks, I guess. And I get a lot of help from my therapist with processing the trauma of the immigration and trauma that gets along of me and my husband both working as physicians, and we have 2 little kids. So I can't emphasize enough on the value of having some mental support. Even it made me a better psychiatrist, I would say.
Wonderful. I wondered if Dr. Yap or Dr. Manolo wanted to go next and kind of describe your experiences and some of your thoughts about well-being. And I think that, you know, although it's such an interesting idea about the flashbacks, we'll get back to that. I think you and I had talked prior to this panel about thinking about the natural cycle of trauma and the risk for PTSD amongst residents in general, and specifically those working in the pandemic. So I guess I will go to Dr. Yap. Do you want to describe to us what your experiences have been like so far, and some of your initial thoughts?
So I'm an emergency physician based or a resident based in Los Angeles. So when the pandemic first hit, we were seeing what was going on in New York, and definitely on my side felt a lot of guilt on being called a healthcare hero, or being showered with food, or like these like healthcare creepy things, because it was like we're not dealing with things at the same level as New York. And now, as the pandemic is going on, we know that California is having more and more cases, and we know we're in this for the long haul. So we're dealing with all the same things that I'm sure the rest of y'all are dealing with. And it's being more and more clear that like wellness on a systemic level, when it comes to being able to advocate for ourselves, making sure that we feel like we have ability to be able to have input in our workplace, being able to feel like we're still being able to make a change and everything isn't futile, is so important. I know for me, I joined the union and became part of leadership because I felt that wellness was oftentimes an empty term that we throw around, especially in medical education. And growing up, we talk about, there's physician suicides and, you're going to be burnt out. And people talk about doing yoga, which, no offense to folks who do yoga, it's great that I'm glad you can do it for yourselves, but like a one-time yoga or a one-time meal from your administration is not going to fix wellness on a systemic level for residents. Like, you can't be well when you're working 60 to 80 to 100 hours a week and not have a say in what those hours look like, because they are so much of your life that if you're just being jerked around, if you don't get to have any sort of autonomy, your wellness is just going to tank and it's not going to work. And I think that's where like our union gets to help us have that say. When we come together, when we work together, we win, right? So I know I was brought onto this panel to kind of talk about the advocacy bits and talk about what we can do on a systemic level to help improve our working conditions, improve our wellness. And I linked a bunch of stuff in the chat when it comes to CIR putting out guidelines on what we think residents should have in the age of COVID. And that was put out in March. We're always looking to edit, to continue to advocate. So please let us know if you have more feedback or things that you think should be added. At the AMA, I helped create the guiding principles to protect residents as well. And that one's a little bit even more broad. And they also have seats on the ACGME and the ABMS. So they're advocating for us on that level. So another individual, I believe, Dr. Moyer put up a position statement talking about physicians being able to speak out from ACP. And for emergency medicine, we have this due process bill on the federal level that's been put out because there were emergency physicians that actually got fired for speaking about not having enough PPE. And I know in California, so what do I mean for like personal wellness? So for me, a lot of my wellness, a lot of my drive and things that make me feel more fulfilled are advocacy bits. I've actually been working with CIR on our first bill ever, woo! And it's here in California. It's actually working on due process protections for residents when it comes to professionalism issues. And I know quite a lot of you probably know about the med bikini situation with 3 white males creating fake social media profiles in the Journal of Vascular Medicine and going on and rating residents on whether or not they're professional. And the anti-professionalism was looking at like women who are wearing bikinis or at Halloween parties or having alcohol in their hand or even doing political advocacy. So I was able to testify on in the California Senate, and this bill is probably going to be passed. And like, for me, that's one way of trying to protect residents and making sure that we get to have wellness, is like making sure we're protected and allowed to have personal lives. Like, it's okay to be humans, guys. So that's like my little bit. Sorry, it took a little bit of time.
Yeah, thank you. Yeah, so I think, as I can definitely reflect on that too, and that, I think it's hard to explain to people outside of medicine how powerless you can feel as a physician a lot of the times. And it's very strange because, obviously, especially if you're working with a diverse population of people who, might be working in meatpacking industries or as housekeepers, and, they're really, terribly affected. But I think, we come into this profession wanting to provide care for people, and we're working in a system that doesn't allow that a lot of the times. And unfortunately, our institutions don't always recognize that or support that, or embrace that mission, and that can certainly exacerbate our sense of helplessness and isolation. And so I think for me, and it sounds like for you, that channeling some of that frustration into advocacy has been really important, for your community, but also for your own personal well-being. So thank you. Dr. Manolo, I wanted to pass it to you and ask you about how your experience has been, and I think it's interesting people talking about this idea, almost of survivor's guilt, and we've gotten into I've heard in different conversations survivor's guilt of not being at the center of the pandemic. I certainly felt that seeing what my colleagues were going through in New York, or perhaps not being on the frontline professions, and wanting to take on that burden. But I think as somebody who trained in Florida, I'm really interested in what your experiences have been like so far, and what it's been like for you to be in touch with colleagues who are there now.
Yeah, for sure. I think in the beginning of the pandemic, the people that worked in hospital leadership, like our DIO, Dr. Diaz, it's very impersonal, my interactions with her. But as we started planning for the pandemic, I really learned about her more on a personal level, and learned about her humanity and how we deal with COVID. And I learned that she's just like me. We're both scared of what could happen to us, to our colleagues. And I realized at that point that she really cared about my own well-being. She would text me literally at 9 p.m. at night to ask me, did you get your mask? How are you doing? And what do you think about this plan for this specific problem? So that I really realized that they're people and they want to help, but we don't know. There were so many unknowns in the beginning of the pandemic, and I had to face my own fear of getting sick, of being at the front line as well. And that fear really went away when I took care of an 8-year-old boy whose mom worked in a nursing home, and he got very sick in our PICU. And I realized that my job here is to help them, to help him get better, and luckily he recovered. Some of the things that I learned about is that the hospital administration, as you said, has this very big fear of looking bad to the public, that we didn't have a plan for the pandemic. Mm-hmm. And sometimes it's frustrating to really work around that, and having some fear of retaliation if you were to speak up. But that experience just gave me more power to advocate for my colleagues, to make sure that we are all safe, that we got all our PPE. Having said that, working through the pandemic is very taxing. And I'm the kind of person who wants more information. I want to take in the news. I want to answer my phone. I want to check my emails. And it took my husband to really tell me, you need to take a break, because I can't take care of other people if I don't take care of myself. So I realized the importance of just turning everything off, taking care of my own well-being, so that I'm able to help others. Talking to my colleagues now as the pandemic is progressing in Florida, I hear their fears, because when you go outside in Miami, people go out like there's no pandemic. They don't wear their masks, they walk around, they dine outside with their friends, they go in big crowds. So at the time in the middle of June when they started opening Miami Beach, that's when I was about to graduate, and I feared for all the tourists coming back and spreading COVID in Miami, and that fear unfortunately came true. So there's a lot more work to be done, but fortunately we had good leadership and strong advocates in our union through CIR to help us go through it. So I give some commendations to my colleagues who are there now, like Lily Oster and Franklin Rocha, who are both running for my position as vice president for Florida, for giving out information to our colleagues to make sure that they have all the information they needed to stay safe during the pandemic.
Thank you. I'm gonna turn it over to Dr. Newsom, but then I'm gonna try to answer some of the questions that have been, to ask some of the questions that have been put into the chat box. So if you guys have more questions that you want to share with us, those of you who are attending this panel, please feel free to go ahead and share them. So Brandon, Dr. Newsom, as you know, somebody who's worked in leadership as a resident, and now you're a fellow, you know, can you describe, you know, your experiences and other things that you might want to touch on that that other panelists have brought up about, you know, how do you work with administration and hold them accountable? And I think, you know, Dr. Moyer in the chat made the point that that, you know, institutions, I think on the whole, are trying to do the right thing, but I do think that the incentives are broken. And sometimes it can be difficult, especially when there is that concern, as Dr. Manolo pointed out, about looking bad and looking unprepared. And we've certainly seen that play out. So can you describe, you know, kind of your experiences, Brandon, and your thoughts about what has happened?
Absolutely. So of course I trained at Boston Medical Center, and you know, Massachusetts was also hit very, very hard. Boston Medical Center is kind of sort of the center for all of the diverse folks. So, you know, pretty much at one point, most of our beds were full of individuals who had COVID or COVID rule-outs. Now that being said, I'm a psychiatrist by training. So for us, they swapped us over to telepsych. So we're largely working from home. And like to that point about survivor's guilt, I mean, I think that was something that, you know, some of my colleagues and I battled with. Like, should we be up on the front lines, you know, up on the COVID, the wards for COVID? Or are we doing the work by trying to make sure that everybody's mental well-being is fine? So one of the things that I make sure for me personally is that I recognize that there are people who could no longer advocate for themselves because they were directly working with patients, working long hours. So it was incumbent upon me to uplift their concerns. So one of the things I'm thankful for is that the hospital, we were able to make weekly labor management meetings where we can just talk to the entire hospital administration just to see where we were up on PPE, you know, where were we up on sick leave, among other things. And then, like I said, uplifting, it gave me an opportunity to uplift things that were important. Like, for instance, they, instead of giving us an additional pot of days, they tried to say, okay, if you're quarantining, then you have to use your accrued sick leave, which makes no sense because it means you wouldn't be able to use that later on. So we took it to the legislature and then went about it that way. At one point, there was this concern that if we reach capacity, then how are we going to decide out who gets the ventilator or not? And the model that they put in place would basically make it so a lot of minority patients would not be able to get the respirators. Their lives would be systemically made to be less based upon the model. And so we tapped into senators, and we tapped into John Santiago, somebody we work well with, to, you know, advocate that no, that's not okay. And I got them to reconsider that. And luckily, we never got to the point where we had to dish out or ration those supplies, but we made it known that that's just not, one, it's not going to happen like that, and that we have to have diverse and resident perspectives upon these things. I will say that it's kind of sort of interesting in a way, right? So I just came from Boston, and in Massachusetts, things have kind of sort of died down. And now I'm in DC, where things are kind of sort of in some ways picking up to where, like, I'm in Massachusetts, I would be able to do more than I can here now. So it's just an interesting experience upon that end. one of the things I can just say that I'm really thankful, and I think we all can say that we're thankful for, is that CIR has been a resource to have these conversations. And I've always been thankful for CIR, and that's why, I've made sure to stay in leadership and work. But in a crisis like this, it just showcases the importance of coming together and having resident leadership to be able to voice concerns.
Yeah, I really appreciate that, Brandon. Thank you so much, and thank you guys all for sharing these very painful and personal stories with our participants. And we are going to be sharing this recording later, so I'm sure that you'll reach a lot of people who may be in the thick of it right now. Some of whom have reached out to me and said that they really wanted to be here, but the timing wouldn't allow. But they're really struggling. And I just wanted to encourage everybody who's on the call. I think all of us get messages from people who are in crisis at different points. We're very comfortable. I can speak for myself and say that I'm very comfortable getting those messages. I'm very comfortable talking through things with people who may be concerned about sharing how their experience has been with people that they're currently working with. So if that's going to be helpful for you, please don't hesitate to reach out. So I wanted to start with one of the questions that we got in the chat from Dr. Ann Cook about interns and students. So in an effort to keep everybody safe, many institutions have policies about who is allowed into the room of a patient who's being treated for COVID. And in many cases, medical students are not allowed into the room, or they may even have been sent home for ward rotations. It seems like in most institutions are coming back, but that certainly affected people's education. And interns may feel left out of the care. So I wondered if any one of the panelists wanted to address that. Perhaps Dr. Yap, somebody in the emergency room, kind of on the front lines, what kind of conversations have you been involved in around that? And what are your thoughts on how to protect education in the sense of teamwork while keeping people safe?
Yeah, absolutely. Fantastic question. I've been lucky to work at an institution where we've gotten to the place where we have enough PPE at the levels that we're using them. But definitely early conversations we were having are like, who gets to intubate and who gets to do these high risk procedures? And early on, initially, like interns, even second years were like not allowed to, just because of the concerns of the risk of like our exposure. And partly other hospitals or other educational institutions in Los Angeles area were also not letting interns and second years do it. So we had a very frank conversation with the institution and our leadership in our residency. It was just like, hey guys, we can't put you guys in danger. And if any of you guys got COVID as interns, med students, second years, and we didn't have these sort of guidelines in place to protect you guys, whereas other institutions here are, like, we could not forgive ourselves. So our residents became understanding when we had that very frank and honest conversation with that promise of continually reevaluate. We've now gone back to the point where we can all do our procedures if they are our patients. But it was good to have that conversation the whole time. For med students still, they're able to be in our department with the understanding that we try to shield them from like patients who seem strictly COVID, but still have them in the conversations when we talk about treating COVID patients, when we talk about, what their physiology looks like. And I think that we've been able to like create this balance with the med students that I think that they have been able to appreciate. And I also talk to them very frankly about the fact that, hey, part of this is to protect you guys because you don't have disability insurance. You don't have the protections that an employee has that we do as resident workers. And if you guys were to catch COVID now, this would be devastating. So we talk about how, it's not so much to like exclude them from the patient care group, but so much as to making sure that we protect their future. And I also promise them that they're going to get to do tons of learning and tons of care for that also as a resident. And I think making sure that you have a very clear conversation and to also hear their thoughts and concerns and be able to respond to them is so incredibly important, because we have to remember that med students are not like little children. They aren't toddlers. We were just there, and to treat them as adults and as colleagues, I think is probably the best thing we can do in the workplace to ensure their wellness.
Yeah, I think that's great. Yeah, so having those open, transparent conversations, and I think that we just have to get used to continuing to have those about everything, because things keep changing and are likely to do so for at least the next year or 2 or 3. I wanted to ask this of all panelists. I really love your thoughts about this, because this is my main area of passion. So I believe this was a question from Dr. Akaka Alex. How do we stop physician suicide? And I know Allah shared those statistics that we do have about the number of physicians that we lose every year. And I will say that, you know, from my extensive reading of the literature, I think that that is a dramatic undercount of how many physicians we are losing to suicide. And I think we're all incredibly concerned about what the future holds for people who have been through these kind of traumatic experiences with COVID, and are likely to relive them and suffer the consequences of that. So if anybody wants to, you know, kind of reflect on that and give me your thoughts, I'd love to hear them. Go ahead, Allah.
So thank you so much for this important question. This is why we are having this panel today. I believe that the importance of access to mental health care is really on and on. I will go on it for the rest of the day. It's the most important thing to have. Some residents don't have insurance to cover their mental health that they need, and they can't afford to go to a therapist every week out of pocket, or go to a psychiatrist out of pocket. So if we don't do our due diligence by, as hospital leaders and insurance leaders, to have access of mental health to every single physician, and it has to be for free, totally for free. I will advocate for that till the last day of my life. People shouldn't be, they are a caregiver, we are caregiver, we care for other people, and they should have that for free. Yeah, I would say it's a it's the number one solution that we all have to look into it, because the statistics show that the people who need the mental health support that they needed, and they don't get it on time, on the right time, unfortunately, for a way or another, even that sometimes that is the reason for the death, but sometimes it's not. But when they do reach that help on time, it does prevent from a lot of tragedies from happening. And being on the two sides of the table, being a psychiatrist who care about physicians' mental health, and also someone who receive therapy and treatment, it just takes a lot of time, and it need a protected time, and it's not a one-time thing like what Anna described before. Even the yoga, you can't do it if you work 16 hours. You can't meditate after working 24 hours. So we have to change the culture around seeking mental health. We can't just go tell the residents, go get the help, period. You have to create the time for it, have the money for it, and also keep the follow-up for it. Those 3 steps. Without them, I can't see any progress in the mental health without it.
Yeah, I think that's, I would 100% agree with that. And I would say the models I'm most excited about are the opt-out therapy models, where, you know, we know that the majority of us are going to need this at some point. And I think, you know, those of us who have been lucky enough to be able to access therapy recognize the ways that it has strengthened our professionalism and our ability to be there for our patients. But I wanted to give the other panelists a chance to weigh in on this. Anybody have other thoughts about preventing physician suicide?
So I can speak on it as well. So as a pediatric cardiologist, my work is very traumatic as well. Like seeing babies and kids die from congenital heart defects is hard. And my own personal mission is to be a good friend and support my own colleagues, and work to eliminate toxicity in our workplace. Because when you're put in a very stressful situation, sometimes people express their stress in different ways, and realizing that I'm not perfect. And I need to make sure I provide a good supportive environment every day that I'm at work, and working hard towards achieving that. And at the University of Miami, whenever there's any type of abuse, we have an anonymous reporting system so that we can change this culture of abuse in medicine and make it a more supportive working environment.
That's wonderful.
So this kind of,
oh, go ahead.
Yeah, no worries. This kind of also answers Dr. Zapman's question a little bit as well, which talks about how do we include or teach med students about self-care and trauma as well. I think that that's definitely an important question to think about when we're talking about this, because I think it needs to be from like ground zero. I know for a lot of us entering medicine, we are oftentimes like very high functioning type A personalities that are too afraid to reach out to help. Oftentimes they'll come from backgrounds where mental health, getting mental health help is a stigma. And I know that
as physician parents, we might have learned that from them.
Oh yeah, absolutely. Or I come from, Asian American background where we know mental health access is just at an all-time low, and that there's a huge stigma against it. And the first time I was ever able to experience process groups or therapy was actually during my psychiatric rotation in third year, where they made space for us and said, you have this much time excused from your in office or in hospital rotation. Instead, this is your process group time. So you're either doing the patient care or you're doing your process groups, and both will count. And it was highly encouraged to go to the process groups. So giving that incentive for med students to be like, no, you don't have to take extra time out of your day or extra, personal work, but instead this is for you to learn, first of all, what are things that like our patients are able to go through, and secondly, how do you process your trauma? And then also making sure that that is a safe space where it was separate from our med ed leadership. It was run by actually like senior residents who were kind of also using this as a training ground for them in their future practice. And it was so incredibly mind-opening or eye-opening, a great experience, and made it okay to access that. And I think it's important to show to med students that yes, it's okay to do this and that you should.
Great. Yeah, I really wanted to hear from my fellow internist, Kelechi, because I don't think that this is something that we do particularly well in internal medicine. And you have been through so much recently. So what are your thoughts on this?
Yeah, absolutely. I was going to emphasize the part about culture and making wellness acceptable. I think that there are times when, residents advocating for wellness sort of receives pushback with regards to things like having adequate training hours, adequate exposure. Are you going to come out half-baked? Training is supposed to be a time of sort of focused exposure and really what you need to prioritize. And so talking about wellness seems to take away from that. And so I think one thing that I've really found helpful in my experience with co-residents has been residents who talk about seeking mental health care, making it acceptable, normalizing, saying that I went to see my psychiatrist and this, as though you were going to the grocery store, because really that's what it should be. And so I think that that's also something that I've recently adopted, is to talk to colleagues about like struggling. And, I think this is one of the few times that I've grieved openly about anything. And I think one of the things that encouraged me to be able to talk freely about it is because I think it gives other people permission to also talk about those things and process them. And I think that the more that I talk about it, it's also helpful to me. And so it's sort of a two-way street. And so I think, so it's, you know, two sides of a coin. One way of dealing with this is talking about it much more, and hopefully that it makes it acceptable to seek mental health, but also makes it acceptable to advocate for wellness. Because at the current point, sometimes it feels as though this is some type of tyrant type behavior to try to ask that residents have, you know, time to take care of themselves or prioritize their wellness when they're in training.
Yeah, so really just making it safe. And, you know, I think I really love that idea that, you know, that vulnerability is a kind of bravery that traditional medical culture has not embraced. And I just want to really thank you, Kelechi, for being vulnerable with us. And I want to thank all of you guys for being vulnerable with us. We're going to wrap up in a few minutes, but I want to give Brandon here the last word, if anything that you wanted to add here.
Yeah, I mean, well, one, I did want to try to tackle that question upon anonymous systems for reporting abuse. So at Boston Medical Center, we have something for medical students, appropriate treatment. It's like a committee, appropriate treatment of medical students or something to that effect. And like if there's ever any issues, they report it. They can report it anonymously. It'll go to a committee to discuss things. And then they'll actually then go and give that feedback back. What we're trying to do, hopefully, is to create a system like that so we can do that for residents, and then also do that not just for like, you know, professionalisms, but things like microaggressions that occur. So those are important things. But I mean, just to wrap up, I will just say thank you. Thank everybody for coming, and thank you for this great panel to, you know, be vulnerable, to share so much. This was a powerful moment for me. This is therapy to me.
I wanna thank you guys so much, and I think I'd like to end today by again reflecting on our loss on Dr. Lorna Breen, and to thank her for her service. Sorry. I think that the conversations about Dr. Breen have been difficult because they've been so reminiscent of so many people that we've lost, where we try to find ways that they're not like us. And I think because it hurts too much to think that this could have been any one of us, this could be any one of us, and that we're all subject to the things that that really affected her, and that she gave so much. And I want to thank her family especially for being so vocal, for being so brave, and refusing to let the stigma that our culture perpetuates silence them, and from honoring her memory and helping others. So I want to say thank you to her, and I want to say thank you to all of our panelists and everybody who joined us here today. So thank you guys so much. We're going to be sharing the recordings. Anybody on the panel who's comfortable, we can also try to find ways to share contact information. I am, as the kids say, extremely online, so I'm easy to find on Twitter, and I have a website, and really totally fine with people reaching out to me if you have you know, personal questions that you want to talk about privately, or if you want to connect with some of our panelists about some of the really important structural things that they've been working on. So again, thank you guys so much.
Yeah, and actually we're going to talk about next steps. Vivian, could you share your screen?
While you're doing that, Vivian, I want to thank Dr. Foreman for joining us today. Really, that was a delight, and we couldn't have done it without you. Thank you.
And thank you so much for your vulnerability. I know that a lot of us probably share those feelings of Dr. Breen. So yeah, it's a tough story to see and read and hear.
Absolutely. Thank you so much, Dr. Porman. I think that, you know, hearing what, like thinking, reflecting upon that suicide, reflecting upon all of our experiences, what we know is that well-being has to be addressed at a systemic level. We can't just be doing one-off yoga things or meditation. We need to have access to mental health. We need to have access to sick days. We need to have access to be human. Point blank, period. Next slide, please. And with that, we wanted to continue the conversation. Let us know what you're doing. Hashtag wellbeing, CIR Wellbeing Ambassadors. We'll like, we'll follow, among other things. And we'll continue this conversation. Next slide, please. But we also wanted to talk to you about what CIR, the National Voice for Residents, is doing next. So we already did a national COVID survey where we talked about the experiences of residents. We also talked about, we already created those COVID-19 demands, and what we'll be doing is reconvening that COVID-19 task force to look at where we are now, because keep in mind those demands were created back in March. We're going to continue the promotion of the Bill of Rights because that is our tool to, you know, not only affect the membership of CIR, but all residency programs. It's a wonderful guide. And then we have an aspirational thing where we want to create a resident well-being task force nationally so we can continue these conversations. But not only that, so we can promote well-being at a systemic level, whether that means policies that we need to implement, among other things. Next slide, please. So this is one of the more important slides. If you get a chance, if you could just screenshot it. The point of contact for that wellbeing task force will be Vivian, who gave our welcome. If you want to do some of that COVID-19 task force work, please reach out to Earl Matherin. And with that, I'll just leave that slide up there, but we thank you so much.
Thanks, everyone. That was an amazing webinar, and we are 4 minutes early than our deadline. Yay! Way to go, time management. I want to thank all the panelist members for joining us today and being part of this discussion. I'm looking forward for similar and more fruitful discussion like this in the future. And again, this is just the first step. We need every one of you to work on this. And someone said that before, it just take a village to be able to change the culture in medicine. And I believe that we can do it all together. And I do believe that every one of you will have an impact on your own personal well-being and the national well-being. Reach out to us at CIR. Reach out to your local friends and colleagues, and reach out to your organization, institution that you are, and start asking about what's going on in my institution and how can I be more involved in any mental well-being activity. And looking forward to see you again in next event. And with that, I will see if we have any other questions, and then we can turn it off. I see that people are thanking us for that panel. Thank you for coming in. I see people want to stay in touch. That's great. Have people advocating from Uganda. Thank you so much, Alex. Yeah, Dr. Perman, you're getting a lot of likes, and people want to stay in touch with you on Facebook page.
Yeah, I'm much more on Twitter, but yeah,
okay,
sure.
Twitter too.
I don't understand Facebook.
Yeah.
And Instagram.
Put the link of your Twitter on your Facebook, and then
Once I start doing that TikTok dance, it's all over.
Yeah, it's all linked together. Okay, thanks so much, everyone, for being here today. If you want to say final words before we close, you feel free to do so.
Thank you, guys.
Yeah. Make some time today to do something to take care of yourself. Share that with us. Bye.
Bye.